helping those you care for to adapt to. We hope through this webinar, you will learn how COVID-19 has affected children, youth, and their families, and what strategies and support tools are emerging in the community. This seminar series aligns with the college's initiative, The Village, which is a student-led world-class health and wellness facility with a mandate to foster a spirit of collaboration between services based in the community. So this webinar series is very much in line with that directive. The mental health and well-being of everyone is a prime concern for all of us. And that is reflected in Canada's student mental health and well-being strategy, which we've launched this year. So again, I thank you for taking time to join us today. A special thank you to our panelists who've taken time out of their busy schedules away from one Zoom meeting to facilitate this Zoom seminar. I thank you for that. And I hope all those participating today will enjoy the presentations and take away some useful advice that we can apply to our day-to-day lives as we continue through this pandemic. So again, welcome, and back to you, Cindy.
Great, thanks, George. Now, let me give just a brief overview of the event today. I have just one housekeeping item to pass along. There will be a time for questions after all of the presentations are finished. But if as you're listening, there is something you would like to ask, please use the chat feature and specify the name of the agency you would like to hear from. That will help us keep everything moving along smoothly. So let's get started. Our first presenters are representing the North Bay Parry Sound District Health Unit. Tricia Hardy is a nurse manager with the health unit and has worked in public health for almost 30 years to promote the health and well-being of children and families. And Auburn LaRose is an epidemiologist who chairs the Nipissing Parry Sound Data Collaborative, which includes representatives from local and family social service agencies. The collaborative is currently leading research into the impacts of COVID-19 locally, which she will discuss in her presentation. Tricia and Auburn, the floor is yours.
Thank you. Good afternoon, everyone. My name is Trish Hardy, and since I am with Public Health, I have the great pleasure of starting off our conversation today by acknowledging the COVID-19 pandemic, which is affecting us all in many different ways. Next slide, please. Our goal today is to actually not talk so much about preventing the transmission of the virus. We're all very familiar with all of the public health measures that we've been talking about over the last months, such as physical distancing, hand hygiene, staying home when you're sick, restricting gatherings, and so forth. Up-to-date information on those measures, if you haven't heard enough about them already, is on the Health Unit website and just about everywhere you look. What we want to talk about more today is the impact that those public health measures and restrictions are inadvertently causing in terms of secondary impacts to families, everybody really, but our focus today is on families and the impacts that some of these measures that result in social isolation and are mounting stress upon stress upon stress for families. So today we want to talk about this invisible pandemic and talk about some of the things that families can do to improve their resilience as we work towards the months to come. We're going to be talking about those impacts throughout our conversation this afternoon, but I'd first like to briefly talk a little bit about the health unit services.
There you go.
And next slide, please.
That's my workout.
Sorry. Okay, so basically we have, all of us have experienced service interruptions because of the pandemic. We've had to reorient the way that we deliver services so that we keep the public safe and service providers safe. And so what that has resulted in is changes to less face-to-face supports and services for families, and more so phone and virtual service. So at the health unit, we have a family health information line, which is a line that's available Monday to Friday that is staffed by a public health nurse. And anybody, families, public service providers, anyone can phone into that line with questions for the public health nurse related specifically to the impacts of COVID on pregnancy, on parenting, breastfeeding, and those kinds of things. And we also have email requests available as well for information. We have been really working hard to keep up with the volume of information coming our way from multiple sources that are providing guidance, as we've learned, related to pregnancy, postpartum feeding, and the birth process, things like that, and parenting. We have posted this information on our website as well for families to access those. And along with that information, you'll see some tips and tricks for keeping your kids safe and working through anxiety and things like that. The other, we still have our breastfeeding support available. We do a lot of breastfeeding support over the phone, but we have still been able to maintain our clinic. And so anybody that is requiring some intervention around that still can make appointments to come to our clinic and can be seen there. We've been maintaining our phone follow-up with families that go home with a new baby. This is a really stressful time to go home with a new baby, maybe without the traditional sort of supports and family around. And even, you know, some families are talking about being sort of feeling ripped off a little bit about the excitement that normally would have happened with this event. So we are providing follow-up by phone to all families in Parry Sound and North Bay districts. We are also continuing our Healthy Babies, Healthy Children visiting program. Normally that's a home visiting program. We are conducting that program right now by phone and moving soon to virtual service with that. And we also have the ability to see people face-to-face if indications are required. And lastly, we've been able to retain some of our prenatal and parenting education online, both for online education and as well as learn as you go codes with things like Triple P. We have other services that we've maintained, but it's easy to go to our website and to search what you're looking for there, and hopefully we can help you out in some way. Next, please. You may have seen as you're driving around or also online over the past few months, colorful messaging that we have been putting out. This was a collaboration amongst community partners that we had planned prior to COVID, and the messaging around this series, this public awareness series for positive parenting, was really all about children's social and emotional well-being and parents' mental well-being. At the time that we planned it, we did not know how timely these messages would be. There's a lot of tips on our website and little video vignettes and things like that. You may want to check it out. Next. Lastly, I just want to mention that we have many resources, again, online or linked to videos and related to mental health well-being. And this one that we're just putting up with the next slide there. Oh, no, that one, sorry, well-being. The 5 ways to well-being is a really easy to remember sort of set of tips that you can keep in mind when you are dealing with stress and feeling a bit overwhelmed as you're sort of navigating COVID-19 as a parent and with your young children. What I like about this is there's some emphasis on one of the things that makes people feel better during times like these is helping others. And so that actually can help improve your own mental health. So there are other resources, obviously, that are out there. I just want to highlight those couple for you today and pass it over to Auburn LaRose, who is the health unit epidemiologist, who's going to share with us data regarding the impacts on our community, particularly on families with COVID-19.
Great, thanks Trish. So today I'm going to summarize some of the research that's been done in local communities and communities across Canada related to the impacts of COVID-19. I'm going to focus on a few different areas, so behavior change, parent mental health, community belonging, family impacts, child mental health, financial impacts, and access to services. And these are all self-reported from participants. So in terms of behavior change, next slide, We're seeing that some parents, in terms of nutrition, are reporting positive impacts, such as eating family meals more often. However, on the whole, we're seeing some negative impacts. We're seeing food insecurity significantly higher than during the pre-pandemic setting. So almost 1 in 7 Canadians said that they were living in households where they experienced food insecurity in the past 30 days. So we know that that has been amplified through the pandemic. In terms of physical activity, some parents are reporting an increase in physical activity, and this comes from the Ontario Parent Survey as a result of being home more often. But we still know through research from Participation that only a very small percentage of children aged 5 to 11 and an even smaller percentage of youth were meeting their 24-hour movement guidelines. In terms of mental health, there's been quite a bit of research that's been done around mental health since the start of the pandemic. We know that the COVID-19 outbreak and restrictions have led to an increase in both anxiety and depression. So we're seeing that the levels of anxiety have quadrupled in the Canadian public and the levels of depression have doubled. Younger to middle-aged adults and parents with young children were more likely to report that they were feeling lonely nearly every day or more than half of the days. So we're seeing this pandemic disproportionately impacting parents with young children and younger parents. Those with children under the age of 11 at home and people with a disability were more likely to be moderately to extremely worried about burnout and lost support. Next slide. In terms of parents and caregiver mental health specifically, from the Ontario Parent Survey, we're seeing that 60% of caregivers reported symptoms that met the criteria for depression within the last week, and that's 10 times the normal rate of mood disorders in adults. We're also seeing that 1/3 of caregivers reported moderate to severe levels of anxiety in the last 2 weeks. So again, parent and caregiver mental health is really being impacted by this pandemic. For children's mental health, we have less data just because children are not typically surveyed. So it relies on parental sort of assessment. So half of all parents reported moderate to high levels of concern for managing their children's remote learning, screen time, anxiety, stress, and behavior. 40% of parents indicated their children's behavior or mood had deteriorated since the start of the pandemic. And both of those are from the Ontario Parent Survey. This is a bit of a mouthful here, so bear with me, but females, young adults, those with lower household incomes, those working outside the home with regular public interaction, those not working because of the pandemic, visible minorities, and those with a disability were most likely to be unsure about how to access services. And this is a survey that comes out of Ottawa. So these are sort of the populations that we know are struggling the most to access the services that they need. Next slide. In terms of the family impacts, most of these relate to financial impacts, but we're also seeing some relationship impacts. So about 50% of parents reported high levels of conflict with their partner or spouse from the start of the pandemic, and this is from the Ontario Parent Survey. Almost 10% of parents reported additional time caregiving for older adults, so individuals were reporting caregiving for both younger and older people. Due to school and daycare closures, many children living with family violence no longer have a safe refuge. So in Canada, Kids Help Phone reported an increase in calls about physical, sexual, and emotional abuse, particularly during the time of school closure earlier this year. In terms of the financial impacts, we're seeing a few impacts here. So nearly 3 in 10 Canadians reported that COVID-19 is having a moderate or major impact on their ability to meet financial obligations or essential needs. So things like rent, mortgage payments, utilities, and groceries. We know that immigrants were significantly more likely than Canadian-born individuals to report that the crisis had a major or moderate impact on their finances. So we're seeing the impacts of the determinants of health here. Half of caregivers reported resource issues, with 34% reporting some loss of income and 48% indicating that a household member had applied for some financial help, and that's from the survey in Ottawa that I mentioned earlier. So None of that data was local research. However, we do know that there have been local impacts. So what we expect to see is that these sorts of changes that have happened over the course of the pandemic have also impacted our local populations. Next slide. The health unit's working in partnership with the organizations that are on the screen and a few other organizations as well to create a community-based research study about how COVID-19 is impacting the lives of people living locally. And this is being done through the Nipissing Parry Sound Data Collaborative. So we have received feedback from multiple organizations about how to move forward with this study and who to study and how to access a variety of different populations of interest to all of our organizations. And so it's our hope that we'll start this research in the new year and be able to really assess how the pandemic has impacted our population. Next slide. So lastly, the path forward will be to conduct a local survey. We'll spend time analyzing the data. We'll disseminate the information to local stakeholders and partners, and then we'll work with community partners to collaborate on addressing the issues that we identify through the survey. Thank you.
Thank you, Tricia and Auburn. I remind you all now that if you have any questions for Tricia or for Auburn, please use the chat feature and specify the North Bay Parry Sound District Health Unit if it's their agency you would like to hear from. Up next, the Nipissing and Parry Sound Children's Aid Society. Nancy LaFrance-Rich is the Director of Service, with the Nipissing and Parry Sound Children's Aid Society. Nancy has a Bachelor of Social Work degree from Laurentian University and a Master of Social Work. She started her career at the Society in 1992 and has worked in all areas of the service related to child welfare, youth justice, and early intervention programs. And Dr. Erin Truswell began her career with the Children's Aid Society in 2012 while pursuing graduate studies at Nipissing University. Erin has held many positions over the years, but her current portfolio includes oversight of quality assurance, IT, privacy, and early intervention services. Erin focuses her volunteer, professional, and personal time on any and all activities that promote services delivery designed for the people. Nancy and Erin are joining us from the Children's Aid Society office in North Bay and are doing so with COVID-19 safety protocols in mind. Nancy and Erin, please go ahead.
Thanks very much, Cindy. On behalf of Erin and myself and the Children's Aid Society, I really want to thank Canada College for the opportunity to participate in this webinar and the important discussion around COVID-19 and the impact that that has had on the organization, our stakeholders, our clients, and really the opportunity to hear from our other community partners around how they're managing it and any innovative practices that they have. So thank you very much for this opportunity. And let's discuss kind of how we've managed this pandemic. So the Nipissing and Parry Sound Children's Aid Society is mandated by the Child, Youth and Family Services Act to provide child protection services in the district of Nipissing and Parry Sound. As we've faced this pandemic, there are various stakeholders that we've had to consider and assess needs and develop service around, including our children in foster care, our clients who are involved with us either voluntarily or mandated by the courts, our foster parents and care providers, our kin and customary care providers as well, numerous volunteers, and of course, last but not least, our staff. Further to our child protection programs, we also offer early intervention programs and a youth justice program.
So the slide that were included here for everyone to just kind of review and digest and for us to discuss was kind of a little bit of an exercise for us to wrap our own brains around what we've kind of managed since March. So it's a little bit of a timeline in our experience around what some of our priorities were in meeting the needs of our service recipients. So in March, our focus was mainly understanding what the closure of services and businesses meant for our particular service area. and starting to really contingency plan around how do we still deliver services? When is face-to-face going to be required? When is virtual going to supplement that? So recognizing that we have various needs, various programs that have different categorizations in terms of essential or not essential. So in April and June really was when we started to implement our new service reality. And that was really a hybrid model of face-to-face where we could and where it was safe with all of the necessary protocols and PPE equipment available, as well as supplementing with virtual where we could. So that was a big exercise in even organizational support, planning for staff and how they're going to use their technology, which was already all mobile. So that kind of put us in a really good position to be on the ground and work from home, but also their capacity in different platforms. Also looking at the privacy aspect of what platforms were the safest to use if you're discussing some pretty sensitive information. So lots of considerations there around our delivery of service, specifically around worker safety, the service recipients' access to reliable Wi-Fi networks, data plans, and technology, and then the mobilization of those virtual service platforms. In July and August was really a maintenance phase for us. So we had a pretty good infrastructure in place, a good plan. Service recipients were feeling supported and, really responded well to the different ways that we were delivering service. So some examples of some unique things that we did during that particular time is we started some various YouTube channels. We moved a local in-person drop-in for pregnant moms called Mother Care. We moved it to a Facebook group, which the participation was actually way better than we expected. We did a lot of video home visits for different things. And we also, as an organization, instituted a reintegration committee. And that was really planning for when the office was going to reopen. So what are all the considerations that we needed to plan for? We have a number of shared office spaces here at our buildings. So what would that look like? How do we keep everyone safe? In September and October was more of a back to normal for us. So our particular organization reopened. So all the staff came back to work on a rotational basis if they shared an office. All of our workers' kids went back to work, which was supporting them and their kind of experience with that. So lots of ups and downs with some runny noses and kids needing to stay home and then being flexible around those things. So a couple other things we did though in preparation for potential disruption to children's lives, in particular if there's another school closure or if they need to be homeschooled for various reasons, either supports can't be provided in school for COVID restrictions. So we started working on some grant applications. We were successful in some to create that contingency infrastructure of respite and support for families and children. And now in November, really our work is looking at some of the lessons learned over the last 6 months as we prepare and mitigate a strategy for a potential second lockdown, which we sincerely hope does not come, but if necessary, making sure again that we're well prepared and that we've reviewed kind of what worked and what didn't and what needed to be tweaked. So that kind of brings us to today, and Nancy will talk a little bit about some of our service trends on the next slide.
Okay, thanks, Erin. So in March of 2020, we saw a pretty considerable reduction in referrals for child protection concerns. And that trend was quite consistent across the province, with many organizations and services providing only virtual or no service. You know, a lot of the community professionals and partners who would otherwise refer any child protection concerns didn't have that direct contact with children and families. And so we definitely saw that decrease, which was somewhat alarming, considering the anticipated stress within the family unit and all the impact of COVID on mental health. And so when we kind of removed some, or when COVID restrictions were lifted somewhat, we've seen an increase of referrals, particularly in 3 areas. We've seen a 33% increase in partner violence, 16% increase in neglect of physical needs, and a 6% increase in physical force and maltreatment. So we are getting those referrals again, and we're having more insight into the impact and the stresses that COVID has brought many of these families.
So our last slide really kind of recaps our approach to helping service recipients and staff hone in on what makes them resilient and how we can promote that within our delivery of service. So really, I would say the majority of this slide, what it's really capturing in all the text, that's a lot on the screen, is that we really are trying to and have been honing in on the unique needs of each family. So some families access virtual supports very well and it works for them. And I think of our youth in care population who are living independently, where it was really isolating for them. And when they're already predisposed to some significant mental health concerns, definitely the lockdown was exacerbating those conditions for them. So, we started to prioritize based on need and, who needs a face-to-face conversation in a safe way? How can we make it safe? How can we make sure the staff's anxiety is okay around those interactions as well? So really focusing, I think a majority of our work and skill has been focusing on the connectedness and supporting that for our service recipients who we know are struggling for sure. And even, some people that sometimes you think don't necessarily need that level. I think of our resource parents, our foster parents, and our kin parents who are taking some pretty challenging children into their care and then being faced with the added responsibility of online learning and promoting their education in that way. So we had an educational liaison who was instrumental, who's a registered teacher, in supporting how do you cover these topics? What can you do when when that particular child is refusing to sit in front of a computer screen? And so supplementing where we could with what we could in a safe way to really make people feel like they are still connected in a meaningful way that is appropriate to what their needs are, I think was true for service recipients and our staff. Interestingly enough, when we were planning our reintegration back to the office, we thought, because staff were reporting higher job satisfaction, being able to work remotely, some staff, but an overwhelming majority really wanted to return to the office, to have that normalcy back, to have that routine back for them was really important for the vast majority. So even some things we thought, you think might work or you don't anticipate coming out of this experience really did. And so understanding kind of, again, what makes everyone tick and how to support what they need in order to be successful in their job and in receiving our services.
Perfect. Thank you, Nancy and Aaron, for participating in our webinar representing the Nipissing Parry Sound Children's Aid Society. Our next presenter is April Porter. April is the manager of the Early On Child and Family Center at Community Living North Bay. She has her Bachelor of Education and is a member of the Ontario College of Teachers. April has worked in education and social services for more than 18 years and has experience on the front line as well as in leadership roles. April, if you'd like to take the floor is yours.
Good afternoon, everyone. Thank you, Cindy. I would also like to thank Canadore College and my fellow panelists for the opportunity to collaborate on this important initiative. It is a timely dialogue, and I hope that you as parents, caregivers, and educators are able to walk away with not only information, but a sense that we are all here to help one another. Community Living North Bay employs close to 300 people and offers many programs to the North Bay area. We at Community Living North Bay envision a community where all citizens thrive, are respected, and valued. And our values are courtesy, respect, dignity, and consideration. Community Living North Bay has many programs that support children, youth, and their families. Some of these programs include the Transitions Program. This program offers support to assist in the facilitating and the transition from high school to adulthood. The transition coordinators provide support to youth from 14 to 21 years of age and their families to plan for their future and connect them to the appropriate community resources and programs. The Inclusion Support Program promotes inclusive quality supports in childcare and early on programs. The resource consultants in this program offer support to children 0 to 12 years of age. The Community Living North Bay Early On program provides early learning and support to families prenatally to age 6. We currently have 13 sites in our district, including a new mobile outreach program that will open in 2021. The Family Home program recruits families in our community who are willing to create a safe and secure place for an adult or child to live. Respite services provide short-term relief support services to primary caregivers and adults and children in our community. Our clinical services team is designed to partner with children and adults, their families, and paid supports to promote social and emotional well-being. And we also have a student nutrition program, which administers provincial funding to schools to support the development and implementation of healthy breakfasts, morning meals, or snacks. Next slide. Community Living North Bay has had to shift the manner in which we deliver services, just as everyone else has. Our children and youth program delivery went from being in-person drop-in or regularly scheduled visits to pre-registered and virtual communication as a way to reach families. We are now providing some in-person services that are either outdoors or carefully planned with minimal contact. Our one-on-one conversations with families about infant sleep patterns or high school homework help has transitioned to phone calls or a Zoom connection. Throughout the spring and summer, the student nutrition program coordinators also prepared and delivered breakfast baskets to families throughout our community. Next slide. Responsive relationships with families are now being built in a virtual space and connecting families to community resources, and that has become a multi-step process. This shift in service delivery has had an effect on families, and the informal data that the Early On program has gathered includes the true appreciation of virtual services and also the need for more in-person services, specifically around early learning, parent support, and mental health strategies. When asked if there was anything else parents caregivers would like to share, some said the following: I would really like to commend the Early On team to the switch to online learning. It has been a challenging pandemic, and we are grateful for how fast and responsive the programming has been, while also being cognizant of and mitigating the pandemic risk. We are very much appreciative of the community-based service. Great job. Our challenges. So this unusual time has provided us with countless challenges, and these include accessibility, a change in program delivery, and community services. We have observed through this pandemic that accessibility for families has been a concern. We have not been able to be in rural communities in order for some families to access services. The Early On program specifically has not been able to open programs in Redbridge, Thorn, or Bonfield. Therefore, we have relied on families to connect with us through virtual programs, and at times, technology has made this difficult. Further, we are providing kits, but families do have to find a way to pick up the kits unless they ask us for assistance. The shift in program delivery has provided challenges as well. Throughout most of this time, we were not able to provide in-person connections, and this resulted in challenges with high school homework assistance or goals, available respite activities, and early learning and perinatal support. Another area that we found difficult to navigate has been providing the community resources available to families. We haven't had a clear picture as to what services looked like and how to access the agencies as we all shifted in how we provided services. Families communicated to our team at that time that they were anxious about COVID-19, felt that they didn't have a lot of time, and were worried about screen time, and these were barriers to participation in our programs. The opportunities. So I wanted to share with all of you the opportunity slide last, because although this has been a challenging and stressful 9 months, it has also provided many openings for change. There has been a pause over a period of time for what can be. This is not to downplay the seriousness of the pandemic in any way, as this has been a chronic global health crisis. However, in playing the cards that we have been dealt, we have found an opportunity not only for a shift in services, but for a shift in thinking, a shift in awareness of what is important. So we looked at our pedagogy and our core services, and we brainstormed what we could offer families. We decided as a team that if we were going to focus on connection with families, that we needed to focus on connection with us, with our team. We decided that if we wanted families to feel a sense of belonging, engagement, expression, and well-being, then we needed to feel that as a team. Therefore, while we were working from home, the Early On team met every morning on Microsoft Teams, and we took time to listen and respond and to ensure everyone had what they needed to be successful in a remote environment. Out of this came creative and out-of-the-box ideas, and we were able to offer support with programs such as Little Cooks in the Kitchen, Triple P parenting sessions, social emotional learning programs, monthly activity calendars, program-specific kits, and for everyone kits. Out of this came strengths and perspective, and out of this came leadership. As the months went on, we were able to loosen some restrictions and provide more in-person services. We moved back into our building and began planning for what came next. The Early On team offered outdoor programming, the transition team continued to offer virtual supports, and the inclusion support team began entering childcare centers. Our agency as a whole has pivoted quickly, just as others have, and we have learned so much about who we are and how we walk with families. We have ensured basic needs are met in a safe and secure environment. We have been adaptable and promoted community inclusion. We have promoted self-determination and empowerment, and we have educated and supported the community to share in our vision. Our Early On team has been able to connect with individual families and with smaller numbers in outdoor programming. We've been able to be the co-learners and discuss child-led discoveries in nature. We've had the time and space to learn with each family and get to know them up close. We are really listening to each other and to families, and we are being gentle and kind with each other as we move through our work. Although this year has not been like any other, staying present in as many moments as possible has created the space for gratitude, and that has been the door to adapting for us during this unprecedented time. Thank you.
Thank you, April. Before moving on to our next presentation, just another quick reminder that if you have questions, please go to the chat feature and ask your questions, and please specify the agency that you would like to hear from. And now for our final presentation, representatives from HANDS, the Family Health Network. Michelle Dermengian is a registered psychologist and director at HANDS. She has a BA from the University of Western Ontario and her master's from the University of Alberta. Her early work was with Integrated Services for Northern Children, multidisciplinary traveling team, living and serving in Northwestern Ontario. She followed that up with a move to Parry Sound, where she has worked for 21 years. Michelle has been a member of local, regional, and provincial working groups that are invested in the development of innovative solutions and shared resources, working toward the creation of a true service system. And Dr. Karen Gratton-Michaud is the Interim Director of Autism and Behavioral Services and the clinical psychologist with HANDS. She's been with the agency for almost 10 years, and prior to this was a psychology professor at both Canada College and Nipissing University. In addition to supporting service delivery for families across the Northeast, Karen has provided policy guidance as a member of the Ministry of Children and Community and Social Services working committees for the Ontario Autism Program. Michelle and Karen, please go ahead.
Thank you, Cindy, and it's good to be with you this afternoon. We just want to begin by highlighting the vision of HANDS as it aligns with today's conversation. HANDS is dedicated to helping children and youth, adults with a developmental disability, and families to achieve the best possible care and help they need when they need it most. The focus today is the client's journey these last number of months and our work in conjunction with partners. Next slide. We felt today's conversation could be one about the impact of COVID through the stories of the families we support. By telling their journey, we can speak to the challenges, success, and future forward considerations as the pandemic continues. When news of the pandemic began, we knew immediately there were urgent shifts to be made. We service many children and youth with complex behavioral and mental health needs, as well as some in long-term care programs. We also knew it was important to keep a pulse on the circumstances of our families, and we did this through reach outs, surveys, evaluations to ensure we were meeting needs appropriately. Next slide. In one of our first reach outs, families clearly told us that the pandemic was affecting them and their family. This was mirrored in the stories we heard, and I quote one of our parents: "How grateful I am to have so much amazing support through this ordeal. It hasn't been an easy road, but it's our journey. Having children with multiple needs is hard enough. Having them not fully understand what's happening around us is even harder. What I've realized is the genuine caring. Everyone has worked hours beyond the normal ones to make us feel that we are not alone. The video conversations, the emails, the texts, and your efforts to make it all happen. I just want to say how special each one of you are, and your dedication to this family will never be forgotten." Next slide. I think as we compare both those really positive stories and then also look at some of the challenges that we've watched and walked through with families, clients have reached out to Hands for a spectrum of services. Some of the stories we share with clients have, for a time, required increased partnership and intensive support with families. As seen in this graph, starting from the first week of March, over the past 36 weeks, more clients have been reaching out in crisis. 21 additional youth were unable to safety plan, requiring hospitalization. The response of Hands employees, stretching their hours, creating new services, and working with families who also leaned in and worked hard to find ways to innovatively work together during the pandemic. And this has been exceptionally uplifting. New slide. Our response as an agency needed to address the emerging client needs across many services in a large catchment area. The first step was to keep our services open. Although we had to exit buildings, Hands did not end services, especially given that in some circumstances we simply couldn't, such as our live-in treatment center and homes. Ironically, our teen clients left our treatment center, not wanting to be separated from family. So, Hands staff developed a new model informed by family communications and evidence-based practice, resulting in what began as a 1 week and now has become a 6-week stay, with additional online training for parents during and after the stay, with 24/7 live coaching support by the treatment center staff. Hands needed to focus heavily on increasing our IPAC, our infection prevention and control measures, establishing new protocols so that we could deliver services in a safe format for both the staff and the clients. This is ever evolving work as the COVID response continues. Hands was a pioneer in the introduction of video conferencing for health service delivery to rural locations, actually beginning over 20 years ago. We've continued to build this into our clinical work and have successfully used technology for consultation, assessments, and therapy delivery throughout this pandemic response. Our programs have increased the number of offerings for families, recognizing the need for increased accessibility. For instance, our autism program offered daily seminars, skill building clinics for parents to support their children and youth who are now at home. Some of the communities that we serve were in fact on lockdown with no access. Nevertheless, service delivery was still critical to our clients, and we worked with partners and families to provide ongoing online services. Over to you, Karen.
Thanks, Michelle. Next slide, please. Thank you. So as Michelle indicated, we did continue to build and pivot. In addition to building new programs and using technology, we also needed to learn to do the work differently, as seen in this quote. Many of our clients receive intensive one-to-one programs that require direct physical support, or may receive supports in schools where we work with the school staff to implement the intervention. We now needed to rely on the caregivers and the families to support intervention. And this required adjustments to our service delivery, such as using enhanced parent coaching models, and also a need to be creative with the delivery of these services through technology, like getting down on the floor with a laptop. Next slide, please. We also needed to be responsive. As Michelle indicated, we had families experiencing crisis that required urgent response. This included a heightened need for respite funding to support families with youth that may be experiencing significant behavioral challenges, have enhanced respite needs due to children now being at home, or families facing new medical crises. Compared to the past 4 years, our autism respite program saw crisis funding applications double. Additionally, our Children and Youth Mental Health Program, which historically didn't provide funds for respite support, needed to reallocate dollars from unused budgets such as travel and use COVID response dollars to meet the increased respite needs of families now in crisis. Next slide, please. We also needed to give families access to information or tools to support their child and youth and keep them informed on program or provincial changes. You will see here a link for a compilation of resources for families on our website that address common questions or needs, such as homeschooling, coping through COVID, access to tools such as social stories or visuals, or even social distancing activities for families. We also compiled all the work that occurred internally through our Building Better, such as virtual service provision or infection control practices, into resource manuals and trainings that have been shared or presented to our provincial counterparts. And we were fortunate to have opportunity to partner with IBM to create a virtual agent that is located on our website, where families can quickly obtain up-to-date information regarding COVID-19, as well as the status of HANS services without needing to call our agency or search our website. Next slide, please. We also needed to continue to maintain our 24/7 crisis response lines and our 24/7 on-call supports for family receiving therapeutic services. And we recognize that caregivers require direct supports as well. For example, we developed a caregiver support group within our autism program that provides peer-to-peer support that's mediated by a team of our social workers. Next slide, please. And we continue to maintain support for our partners who are also seeing significant increase in service demand. As seen here, you can see that the North Bay Eating Disorder Clinic saw a significant increase in reach out referrals up to 4 to 5 times per week. And we continue to support them through our therapeutic services, such as cognitive behavioral therapy for anxiety. And we needed to support those partners that now had a plan for change, such as our school boards, where children with autism and developmental disabilities now required support transitioning back to classrooms that had very different expectations than when they left. Next slide, please. Michelle?
Thanks. So we, in some of our reach outs, we're asking families a variety of questions, and 2/3 of our families, surprisingly to us, told us that the use of technology actually increased accessibility compared to pre-pandemic times. HANS learned that virtual services enhanced responsiveness and was able to meet family needs in a more timely and accessible manner. The treatment center, DBT, autism, they've primarily been center-based services, but have remained accessible during this pandemic. It's anticipated that a hybrid service will honor the client request to maintain virtual services post-pandemic, further reducing geographic, time of day, and travel barriers. The family quoted would have previously been strained to engage in the degree of service in person as much as they needed, if it were a center-based or at home, without the benefit of signing on and off over an extended daytime period for a full session with her therapist. Next slide. Despite the availability of services and our communities trying to be there for one another, children, youth, and families have let us know they are stressed and are reaching out. Over 1,100 clients have been served since April 1st and have sought new mental health services. I have 2 quick stories though from staff regarding these services. One staff shared, I have a new client who's never been in counseling and has significant emotion regulation problems, which resulted in a family breakdown. She's back at home now, and in a recent session was able to go over emotion cards with me. I held these up to the screen just to help her identify her own emotions and expand on them. It turned out to be a huge breakthrough, and since then we've started to work on our strategies to regulate emotions. The other great report is from a little guy who agreed to meet with a staff member and wanted to work on his anger. He's only 7 years old. Mom shared as far as she knows he's never talked about his emotions before. He's always gone into shutdown mode. The staff says, I was so impressed. He was able to do this over a computer screen with somebody he had never met before in person. These are just glimpses into the success stories of engagement with clients and their families. Back over to you, Karen.
Thanks. We also learned that only half of the clients surveyed wanted to return to full face-to-face services once those services were available as an offering. Families really expressed the appreciation for the flexibility, but more so the opportunity to experience the service alongside their child and youth. As I mentioned, a lot of our services are center-based, and being able to access these services now virtually allowed families to see and hear what their child was working on in the moment. And as you can see here, one of those families did indicate that it was a really big, beautiful addition. Next slide, please. And along with that, the majority of families told us that they were just happy with services as they received them, that there weren't a lot of recommendations or changes that they wanted with regards to our going back to services. They saw the benefit in the hybrid model that we created. And as such, as we continue to offer face-to-face services, we are continuing to offer the blended model for all of our families so that there's a virtual component built into those face-to-face services as well. Michelle? Oh, no, this is still me, I apologize. We have also, and as I indicate here, closed over 210 families from service. 94% of those families have indicated a positive outcome for their family. And this quote is one of our favorites. It comes from a little 7-year-old boy who has autism. And through many channels, this mom was determined to let us know that in the eyes of her little boy, we were one of his favorite people. Because in his mind, in his perspective, we were helping his mom, and that meant the world to him. Now to Michelle.
And so future forward, we really must continue to listen to our families and the stories that they have to share. We hear timeframes that suggest a sense of the familiar may come to us late 2021, but we also hear that things may never be the same. Regardless, we can anticipate that the impact of COVID will be long-lasting, and we must continue to be agile and responsive. We wanted to end this with a youth quote who's part of the Mental Health and Substance Use Prevention campaign, geared and led by youth and young adults. It outlines our ongoing need to evolve. We want to continue to listen, to pivot, and then be responsive to the needs and how we serve them. Thanks for this opportunity to share with you today.
And thank you, Michelle and Karen. We're getting, and of course the other panelists too, we're heading into the part of the webinar where we'll be answering some of your questions. So please go to the chat feature, ask your questions, and please specify the agency that you would like to hear from. But before we go to the participants' questions, during the last webinar, we discussed the concept of resilience, the 4 C's of resilience: control, care, coherence, and connectedness. I'd like you to briefly talk about ways your agency is promoting using this framework. Let's start with the health unit. Okay, let's move on to the Children's Aid Society.
I can go ahead and start, and then maybe Nancy can jump in a little bit. So I think in terms of that particular framework, it's really understanding that it's a continuum for some people, and that they may need different things at different times. And so it's keeping a pulse on all of those moving parts and honing in on, what aspects need extra support. So, and again, recognizing that it's different for everyone, and some people have really good social supports that they could rely on, virtually during a lockdown period. But I think of, our own experience with staff here at the agency. We had a number of staff who loved working from home. It was wonderful. It was the best work-life balance they've ever experienced. And then some of us, myself included, with young children at home, had quite the opposite experience of working at home, where it was more stressful, led to longer days, longer hours, and being pulled in lots of directions. So I think it's just understanding where everybody fits and honing in on their own particular situation and needs.
Yeah, can you hear me?
Yeah.
Okay. Yeah, I would agree, Erin. And I think when we look at the various stakeholders that we service, we have care providers that are elderly, for example. So virtual support doesn't really meet their needs, especially after they've been on technology all day. And so we realize that that direct connection with the various stakeholders really had to be tweaked to meet their unique needs. With our kids in care, virtual wouldn't really cut it for a lot of them. That direct connection was so critical for them, and just to know that people didn't forget about them, that people were tracking them. So our children's service staff ensured that they had minimally weekly contact with our kids in care. So every kind of group that we service, we really did need to assess kind of those components of resiliency and how we would incorporate that, including our staff, where flexibility was required.
Thank you. Now, what about the perspective from community living? April?
So with community living, if we think of the 4 C's, I like to relate it back to how we care, control, have a sense of coherence and connectedness with the team and the staff themselves. So working at the 4 C's and thinking about how are we connected? What does that look like? Is there a sense of coherence? Does everybody have what they need in order to be successful? Are they using the tools that they have? And then being able to forward that to the families that we walk with in each of the programs that we work with here at Community Living.
And what about hands?
Thanks, Cindy. I would say I would relate it to Maslow's hierarchy of needs, and that there's that need for a sense of space, stability, having the resources that one needs in order to be able then to thrive more. And I would say that that's true both for the staff and for the clients we serve. So literally within that first week, it was making sure that people were at home with a confidential, safe space that was meeting their ergonomic needs, that they had their phone on their computer, that everything could be held confidentially. And then we were working with those staff that had connectivity issues or didn't have confidential spaces and making those kinds of arrangements. And then that really translates also with our families. Did they have a sufficient confidentiality for the type of work, for the type of client, whether they were a child, a youth, or a parent? Did they have the right resource needs? And so some of our initial reach outs to our children, youth, and families were to ask them, do you have connectivity? Would you prefer just to meet by phone? Would you like to meet face by face? We were really quite surprised that over 80% of our clients had internet connection, but initially would rather meet by phone. And then over time it increased, but it was learning to pivot and respond with their needs. When they felt that they were safe, they had fiddled around. We had found out that it was okay if a cat walked across one's keyboard while you were in the middle of a meeting, and we could laugh with one another, that then they were able to move and lean into taking care of their own mental health needs and the needs of their family members. So it was really lovely to see, as I say, both with the staff and with the clients, establishing that foundation, and then they're being able to be very responsive and connected with one another.
Perfect, thanks. Auburn and Tricia, can you speak to how the health unit is promoting the use of the framework, the 4 C's of resilience, control, care, coherence, and connectedness?
Sorry, I missed the clicking earlier, so thanks for coming back around to me. I just want to sort of add a little different dimension to some of what others have already shared around staff that are working at the health unit. As you're probably aware, a lot of our staff have been redeployed to COVID activity, so work that is nothing like what they normally do on their day-to-day basis. And they're either deployed for a period of time or in and out, and all of that's really unpredictable. And so our staff then will return to their program area for a short time and start to get reinvested in working on something and have to change again. So I think that when I was hearing those terms, I was thinking of them and the tremendous job that they've done in terms of pivoting and being flexible. And then the other piece that relates to the families that they work with is that they all sort of talked about, we suspended our Healthy Babies Home Visiting program for a period of time when the staff were deployed at the initial onset of the pandemic. And they were all really concerned about re-engaging with their families. Were their families going to trust them? Were they going to be able to, were there going to be abandonment sort of feelings that would happen that folks may have had bad experiences with in the past, and those kinds of things. And they were really pleasantly surprised when they were able to start to reach out, that the families were very much relieved to have contact back again, and we're actually ready to start working on some things. And so I think to me that's a really good example of those 4 C's at play.
Okay, now let's move on to the participants' question. The first question is for the health unit. How will the research findings be communicated? Will there be a community media communication strategy? And when do you expect to share those findings?
That's a great question. So we're going to be sharing them in a variety of different ways. We want to share them back with people who have completed the survey and taken time to share their perspectives. And typically the way that we do that is through our website or through social media posts. We also plan to work with the agencies that have dedicated time and resources to reviewing the survey, adding to the survey, providing their perspective, and in some cases adding their own questions. So we want the survey to benefit the work that all of the agencies on this panel, but also the agencies of people who are listening in. We want it to benefit the work that you are doing also. We do have partnerships with some of the local First Nation communities. And so data will be given back to the First Nation communities so that they're able to assess their own priorities. And that's an important principle in the work that we're doing around Indigenous data collection and abiding by the principles of OCAP. We expect this survey results to be shared early next year, so February, maybe the beginning of March, depending on how long the survey remains open and our response rate. So that should, that timeline might shift a little bit, but that's sort of our goal at this point.
The next question is for the Children's Aid Society. Who is keeping track of the families that are choosing to not send their kids to school, who are keeping their kids at home? And because they're not at school, staff there aren't seeing or hearing about the abuse of our students to make the CAS protection calls.
Yes, that's a good question. And we have been in communication with all school boards to kind of develop a protocol on how to manage those cases and those concerns. Certainly not every one of these cases fall within child protection. And so every call we receive, we kind of do our own analysis based on the age of the kids and the information we have, whether or not it merits involvement by the society, and if we can take a helping approach to connect with that family to assess if they have any needs that are prohibiting the child's attendance or participation in school, whether that be at home or in community, and also to promote better communication with the school around how they are meeting their kids' needs. So every case is assessed separately.
Yeah, and I'll just add to Nancy's point, just logistically, we have had a number of calls from teachers reporting concerns that, this particular child, the family is learning at home. However, we're concerned about the child's, what's been submitted or the consistency in their participation. So although they're not at school and they are learning at home, there still is a connection to the teacher in a classroom. They're still assigned those pieces. So we still do become, looped in if there is that disconnect happening and the teacher becomes concerned.
Perfect, thanks, Erin. The third question is for the panel. How many of you have interacted with families without access to the resources for online learning, virtual intervention, care, and therapy? And if so, how have you overcome this challenge? Let's start with hands.
I can speak briefly to, and then I also encourage Michelle to speak to it as well. Our service catchment area is quite large, so we provide services from Muskoka, Parry Sound, all the way to the James Bay coast. So we have a number of families who are in remote, rural, Indigenous communities far north who don't have access to virtual technology. So we've had to be creative. Sometimes that means that we are mailing resources and meeting with families on the phone. Sometimes it means that we're trying to coordinate with other community partners. So for instance, the Peterbic Health Unit to help us deliver information to families to support them that way. And a lot of connections through school communities and school boards. Really, at the end of the day, it's about trying to be as creative as you can, recognizing that not everybody has the same level of access. Michelle, do you have anything else you want to add?
Sure. One of the things I might mention is that we have a wide variety of credentials across our agency. So psychotherapists, therapists with BCBA, psychologists, social workers, and everybody's college has different level of qualification for providing online or virtual services. And I think that was one of the things that we looked at initially, was really creating a matrix of what do our staff even need to be able to provide services online in an ethical manner and in a way that provides some of the additional training. So that was within about the second week we had identified that as a significant need and immediately started training that week, and then ensured that we had ongoing training both from within and then from external resources, just to really make sure that our staff had the confidence and the comfort in providing those virtual services. It is a learning curve.
Thank you. Now, what about community living? April, how have you overcome this challenge?
So I would say that it's an ongoing challenge for us. We definitely put into place strategies at the very beginning. We've done a lot of phone calls. We've done contactless delivery of groceries, infant food cupboard items, anything that the families needed throughout the summer months. And we've also, delivered kits, virtual program kits that they can still partake in and use. And we've talked to families again over the phone with what resources we had available for them. But we can't reach the families that we don't know about. So that is always something we're thinking about and looking to somehow get the word out that we are here, and if they need us, where to reach us.
Good, thank you. Now, in terms of the Children's Aid Society, Erin, Nancy, how have you overcome that challenge?
Yeah, I can take this one. So we really, again, a lot of it was contingency planning and anticipating kind of what some of those hiccups might be. So, we started to inventory what technology we had available that we could repurpose. So, we do upgrades and we have some older tech. So we started to really look at, okay, an inventory. We have this many laptops. Okay, we need to clean them off, get them, from a privacy perspective, get them all cleaned up, ready to go. So we actually redeployed a lot of our unused tech to any family that couldn't participate in our services virtually but wanted to. The other stumbling block was, there's quite a few of our service recipients who don't have data plans, or who have data plans that cap out, and they're saying, you want me to do ABC in terms of community services in order to safety plan or in order to meet the service plan goals that I have with your agency, but I don't have. So really, we started to look at, okay, well, what can we provide them? So we looked at prepaid kind of data plans attached to prepaid phones. And then, I actually anticipated a higher volume of people needing that tech support, but it was less than we anticipated. So I think it was just, looking at all the barriers and then really planning what we had, what we could provide within reasonable funding constraints, but making sure that we were removing any and all barriers possible so that people who were actively trying to access services, virtually in particular, were set up and could participate in those, because a lot of that is work they need to do as a family to, resolve some of the risk there.
Perfect, thanks, Erin. And Auburn and Tricia, what about from the perspective of the health unit? What has been happening there to overcome this challenge?
So much of the same. We have had again, surprised how little people have identified that they can't have access in this way. We have been doing many of the same kind of strategies with the kits and the access through the phone and those kinds of things. We are starting to explore making devices available in a limited way, and we'd welcome sort of to learn from anybody's experiences that have already done this, but we're definitely exploring that to reduce some of these barriers. And I guess the other piece that is there are some people who just don't have internet at all. So it's not a matter of devices or plans or those kinds of things. They just do not have access to the internet. And, you know, I think we're all probably needing to figure out what we can do to support those families. And I really want to echo the piece that April raised around, these are the families that we are already engaged with, that we're identifying some challenges, but I too am worried about those that we don't even know about.
Perfect, thank you. The next question is for HANDS. Does HANDS assist families who are in crisis with the crisis respite application funding process mentioned? Is there an age criteria, and can it be someone HANDS is not currently supporting?
So that's a really great question. And I would say if it's in reference to the crisis applications that we had mentioned earlier, I'll speak to the one around mental health and Karen can speak to the one around autism. The respite that we were providing was for children and families who are engaged in our services and who were really struggling to find that the mental health treatment was sufficient for them. So really it's a way to assist in terms of preventing further family breakdown. And so if a family and their child is struggling and needing mental health supports, first we would really recommend sort of that least intrusive piece of coming in and having mental health sessions together, and then also looking at how we can additionally provide some of that respite just to ensure that our families aren't breaking down at this point in time. So the shortest answer is yes, you need to be coming into HANDS for service in order to access that, but we'd want to try to work as quickly as possible with the family.
Thank you, Michelle. With regards to the autism-specific funding, you do not need to be a HANDS client. You do need to have a diagnosis of ASD, or your family member needs to have a diagnosis of ASD. And it's for any child or youth 0 to 18. To apply, we can assist you with that application process. You can call our family service team at extension 1333. Any HANDS numbers work for that extension. That's extension 1333. And the family service team can direct you to the application and also help you with the application process.
Perfect, thanks, Karen. The next question is for the panel. As you envision the recovery and post-recovery phase of the pandemic, will you continue any of your innovative practices and strategies? If yes, what will you continue? Let's start with the health unit.
Well, I guess, I don't know if this is innovative, but one of the things, there's been opportunities coming out of the pandemic that we might not have anticipated. And one of the ones that I've seen over time that I'd like to see continue, obviously, we all would, is because we're all facing the same set of challenges and circumstances to try to navigate in the last little while, we've been able to come together, I think, more as a group in terms of community partners who already had an interest in children and youth and families, to try to do some more collective brainstorming and some more coordinated action, or at least like building on something that another agency has been able to do already. And I think that's a real it's not an innovation, I think, but I think innovative things can come out of that ongoing partnership that partly has been made possible by bringing us together with the pandemic, ironically enough.
And I would add to that too, that in terms of the community-based research that we're looking at more recently, we can anticipate that the impacts of the pandemic will be long-term and not yet obvious. There might be trends that we see in children in 10 years who were impacted through the pandemic. And so our intention is to maintain that surveillance and that research activity within the community to see how this pandemic has truly impacted our populations locally.
Perfect, thanks, Auburn. Now, the Children's Aid Society.
For sure, there's definitely lessons learned. I think the use of technology for sure has taught us that we can enhance a lot of what we're doing through YouTubing, Facebook, Instagram. A lot of that social network platform, you know, that previous to now, we didn't really use like we are right now. So for sure, that type of innovation is something I definitely see us incorporating into service. Staff working from home may be another area that we look at, you know, and how do we work that in and what promotes better staff morale and wellness. So I think what the pandemic has taught us is that there's tremendous opportunity for innovation. And when we reflect on these practices, as we will in the months and possibly years to come, there'll be lots of opportunity to kind of integrate some of this new learning and experience into practice.
Okay, thanks, Nancy. Now let me see who's next on the list, community living.
So we will definitely still offer virtual programming. I don't know what that will look like going forward and how much of it we will offer, but we will always look at the feedback from our families for that information. I think something that the early on team has really talked about is the connectedness that we feel together as a team, and also the ability to have time and space with families. So we really want to keep those things going and moving forward as this pandemic changes. And so the ways we can do that is, you know, connecting with the team on a regular basis and ensuring that everybody feels supported and has what they need has been something that I've learned a lot about. And also from the feedback of the families and the staff is that they really do have a lot of time and space for the individual families. And that is gold to us, and we don't want to lose that moving forward.
Thanks, April. Now to hands.
I think one of our significant lessons learned is the hybrid model that we've implemented at our treatment center, and just the ability to work much more frequently and for greater lengths of time with the parents. The treatment center is in North Bay, but it serves Nipissing, Parry Sound, and Muskoka clients. And so some of our clients are up to 2 hours away from their families. And so in the past, there's been a perceived barrier of the staff at the treatment center being able to truly be as engaged with families. And this has really provided an opportunity for us to have immediate, daily, and 24/7 engagement with families on an as needed basis. And I think a second one that's really been important is our groups. Again, because we serve so many small communities, that it might be easier to bring a group of children or youth together in North Bay, but it really meant that other groups sometimes were unable to get sufficient numbers of people together, and so they would be canceled. And what we found is everybody has a level playing field at this point in time. And even for families that had no means of transportation, so once the child came home from school, there was no way to get them to a group or get them into service, they're now able to be served. And so I think this is really provided, whether it's by phone or by video, that we truly are able to serve more of our children and families and in more of an equitable way.
Perfect, thank you. The next question is, and again, it's for all of the panel, is there a long wait list for families to access services, and how are the agencies managing the wait list? Let's start with hands.
I can't speak to all the wait lists. I can tell you that some strategies that we put in place for the autism program were to have pre-service elements. So really trying to build the foundational supports around families, the parent capacity through seminars, workshops, trainings. And we were able to amplify those through COVID, especially given that we could provide those virtually. So we've been using those to support families while they're waiting for service. And we've also been finding that those have enhanced the services that they're receiving. So the outcome success is much greater because they're receiving that pre-service. So that's a piece that we did put in place. We're not seeing a significant challenge with managing wait lists, fortunately. I don't think our services aren't as crisis-based as other services that we provide though. So Michelle, I'm not sure if there's information that you wanted to provide about the mental health services.
Thanks. So one of the things that we continue to provide are 2 days a week for single session treatment services that are available. And so even while a family's on a wait list, they can attend any of those. We used to call them walk-in, but now they're virtual counseling clinics that are available and that a family can sign up for. There are wait lists, and those wait lists are continuing. We're part of a consortium of lead agencies for mental health, and we also have Children's Mental Health Ontario, who also advocates looking for additional funding and responsiveness. I think to be very fair, though, we've had a good partnership with our school boards, and school boards have also received significant additional funding for mental health. And so our children and youth, in the ability to return to school, are actually having additional services for up to 6 sessions with mental health providers. So that's been a very positive partnership.
What about the health unit?
So the only one of our services that we have waitlists for is the Healthy Babies, Healthy Children program. And we've been able to actually pick up 70 or 80 families since we reactivated with our clients early this summer. But there are more families being added to that. So we still do have a wait list of approximately 45 or 50 families that we'll continue to try to work through over the next while.
Perfect. And the Nipissing and Parry Sound Children's Aid Society.
Well, we're a mandated society, so there is no waiting list. And in terms of our early intervention programs, Erin, you could speak to that. There is no wait list either for our youth justice program, as our referral source is probation.
Yeah, so as Nancy mentioned, we have voluntary and non-voluntary services. So child welfare and youth justice are non-voluntary. There's not a choice, so it's not a choice to service. We have to. There are standards to meet in terms of how many days that within the particular case that the child needs to be seen. But in early intervention, all of those services are voluntary. And in terms of waitlists, I used to be the supervisor of the program in 2013, 14, and I currently oversee it still. So our approach to waitlists has really always been nobody wants a waitlist, and we haven't had one in the last 5 years. So it's really about prioritizing. You know, you take every single case and you review, okay, I was seeing this family bi-weekly, can they shift to a monthly check-in or a bi-monthly check-in? Or, you know, can we adjust a little bit so that everybody at least gets eyes on, an assessment, some recommendations, gets that ball rolling a little bit. So we don't have any wait lists in those programs.
Okay, and what about community living? April, what about wait lists with your agency?
I can't speak for the other programs in my agency, but I can speak for early on. And we don't have wait lists, a formal wait list, but we do have wait lists for our programs at this time because we are limited to the participants that we can have in them, so outdoor and virtual. However, we do offer them in 6-week sessions. So if we do have a wait list with Say and Sign or Discoveries in Nature, then we look at that and we plan for the next 6 weeks to have another session.
Thank you. The next question is really a comment to all of the panelists and to all caregivers, educators, and parents of children and youth. You have all pivoted so quickly to adapt, and you should all be commended. The next question is for the health unit. From your point of view, as you are very close to the pulse of the health of the communities in our districts, and after hearing about what the issues families have experienced during the pandemic, what priorities should be addressed during the recovery and post-recovery phase?
Aubrey, maybe I'll just go first, and then if you want to speak to data on this. But I think it's interesting because our community partnership collaborative approach to positive parenting, there's at least 19 or 20 agencies that sit on that table, and we've recently spent a last number of our meetings brainstorming and sharing what we would be hearing from our clients through the different agencies regarding their perceptions of the sort of negative or the secondary impacts on them as families living through COVID. And 2 things come to the top, and they come to the top in what we hear in the news everywhere, but we're hearing it locally. And that is social isolation the idea of not feeling like you can be connected to others for support, and feeling lonely as you're working through this, obviously contributes to, for some people, to anxiety or depression, or it's just a chronic level of stress that isn't going away anytime soon, I guess. So we heard that loud and clear, that isolation was probably the #1 thing that families were sharing with all of our agencies, including school boards were there as well. The other piece was this the dealing with uncertainty and the unknown, and what that also impact that can have on your mental well-being. And so those two pieces, I think, are mental health and wellness, and isolation are the two biggest things that have come up in the anecdotal comments that we've been gathering. And I think we'll see that come up in the data, but I'm going to ask Auburn to comment on that.
Yeah, Trish, that's exactly right. So as I mentioned during the presentation, mental health is by far one of the most researched and also impacted areas of health that's come out of the pandemic that's not directly related to COVID-19. We're calling it an indirect impact. I think the thing to think about too as we move forward is we know that COVID-19, both as a virus and also in terms of the indirect impacts, are disproportionately impacting different communities. So we're seeing that First Nations communities, racialized communities, people that are already living in low income, and new immigrants are being disproportionately impacted by the virus in lots of different ways. So one of the key priorities I think that we'll have moving forward is to continue the collaborations that we've started as a result of these impacts, continue to engage with local First Nations communities, with both of our local friendship centers in North Bay and Parry Sound, and with other agencies that are like the ones on this panel that are trying their best to impact the vulnerable populations that they're tasked with improving their health and improving access to services.
And if I just add one other thing to that, is that so we know that the impacts are, there's an inequity there in the impacts, but I think it's interesting for many of us who've been working in the field of mental health for a long time, either directly or indirectly. And one of the biggest challenges in doing that is stigma, or, people about mental health or mental illness, the whole sort of continuum with that. And there's another interesting opportunity in COVID, I think, in terms of that this is impacting every single person in some way. And so the conversations that I'm hearing about mental health and mental well-being are happening more easily, more frequently. People are being more open. And I think that conversation is really, really helpful. And maybe we can sort of build on that as we try to figure out how to support families with mental well-being, as not just through the pandemic, but in an ongoing way. I just, again, it's another one of those ironic opportunities.
Okay, thank you. The next question is for Hans. What has the feedback been in terms of the caregiver support group and the IBM virtual agent?
Sure, I can take that one. We didn't overtly announce the IBM virtual agent. The feedback that we have received, though, is that it is an effective tool for those who have had opportunity to use it. I would encourage folks to take a look for it. We do monitor the trends and the questions that are asked to get a better understanding of its usefulness. So we're very open to that feedback. With regards to the caregiver support groups, though, we have more data on that piece for sure. And I think it goes back to that idea of connectedness. It was very important for us to ensure that our families knew that as they went into this significant change, that they were not alone. And there is value in families seeing themselves in others and having that opportunity to talk about shared experiences, how they're managing, learn from each other. And that's been an exceptionally valuable addition to our service offerings for sure.
Okay, the next question. Thanks, Karen. The next question. It's for community living. April, is there a way to talk to a staff member I used to speak to a staff member about my parenting and my daughter's progress. I've been disconnected and would like to reach out for that service again. Also, Early On is an incredible service within our community. Thank you.
Thank you, Carla. Absolutely. You can contact us. Currently, our hours are 8:30 to 4:30 from Monday to Friday. And you can call us at 705-474-8910. Or if you prefer to email, reach out at eyc@communitylivingnorthbay.org. We look forward to hearing from you. Thank you.
Thanks, April. The next question is for Hans. What happens when kids and parents are not liking the virtual approach?
That's an awesome question. And we have quite quickly shifted to either phone-based, or now as the summertime came into play, we were individuals in open spaces where we knew that they could keep a physical distance and yet still have that connectedness. And what we're now finding is we're offering a hybrid service. And some families are just finding that they need to have that physical personal space once, and then they're able to do some online, whether that's by phone or whether that is using video conferencing. But we're really trying to be responsive to the client needs.
Can I just add in too that we've also recognized that clinically, not everyone can benefit from virtual services. They're definitely valuable, they're important to our service, but I think a piece that I'd like to highlight is that we as an agency did, I think, an excellent job in establishing effective infection protection control processes, so that for those really complex children or those families that just can't benefit from those virtual services, we've been able to move back to face-to-face services as appropriate. So I think it's just remembering that it's that blended approach and ensuring that we're meeting the family's needs on an individual basis based on the clinical needs as well.
Perfect, thank you. This next question is for the entire panel. Do you provide services outside of 9 to 5? And we will start with community living. April.
Thank you. So currently we are 8:30 to 4:30 Monday to Friday, but in January, beginning January 11th, we will be having our Tuesday evenings again. So we will be open until 7:30, and we will provide support and virtual programming all the way till 7:30. We will be looking at Saturdays again soon.
And Nipissing and Parry Sound Children's Aid Society.
Hi. So our office is open 8:30 to 4:30, but we do not keep set hours at all, especially with child protection work. We have on-call people who go out in the field if a child protection call comes in that warrants eyes on. So that's a 24/7 service with respect to child protection. And in our voluntary services, it's an expectation actually of all staff that they work flexible hours. We have a number of parents who work during the day, 9 to 5, and can only meet to, do an assessment or review the progress after that. So we are very flexible with staff, and we just expect that they either flex their day or flex their week. So come in later one day, come in, earlier another day, and that's worked really well. And it's really about respecting, everybody's individual experiences and making sure that, again, we're removing all barriers possible to accessing the service that they want and that they're engaged with.
Thanks, Erin. Let's go now to the health unit.
Hi, our Healthy Families programming, most of that is delivered Monday to Friday. We did do face-to-face education on weekends at times before COVID. But we have a lot of COVID work going on 7 days a week. So if anybody has, I'm just kidding.
Okay, and next, Hans. What about hours there?
Certainly. So we have our traditional hours of 8:30 to 4:30, but on Tuesdays and Thursdays, we're open till 7. And the last appointment that we would book is at 5:30 for clients. And then on other weekends, similar to what Erin was sharing with respect to the Children's Aid Society, we have staff who are very willing to be flexible to meet the needs of our clients. We do have a variety of other programs beyond mental health that in fact function on the weekends only, or that function 24/7. We have a crisis line that our staff themselves monitor until 9 p.m. And then we provide 2 sessions on Saturdays and Sundays as a follow-up for clients who have been in crisis on the weekends. So we've tried to be as flexible as possible within the resources that we have.
Okay, thank you all. That's all the time we have for this session, and we hope you've enjoyed it. This is the second of 3 sessions planned, and the next webinar aimed at older adults is scheduled for January 20th, 2021. A big thank you to all of our panelists for this session. If you're interested in participating in the next webinar, you can register after this session ends at canadacollege.ca/webinar. In the meantime, after this session, you will be prompted to complete a questionnaire on this session. We are really looking forward to your feedback as we plan for the next one. So if you could fill it out, it will pop up after this session ends. We would be very grateful. Thanks again to all our participants, and bye for now.